We will start swasta vrutta. So, what is the prayojana of Ayurveda? So, from first year BMS, we learned about prayojana of Ayurveda. That is the first sloka you maybe learned in first year BMS. Swastasya, swasta rakshanam, atrasya, vikaram, prasham. So, Ayurveda as a life science emerged on 2 ends. Okay, basically, Ayurveda emerged on 2 ends. One is swastasya, swastarasya. We need to prevent health in a healthy individual. Already we have a good health, so we need to prevent it. So till the death. So that is swastasya, swastya, raksha. Atarasya, vikara, prashana. Second one is if disease comes. Suppose disease comes, we need to cure the disease. Okay. So this is the elaborate explanation. We have read all the vrutta since the emerge of Ayurveda. So these are all the main 2 ends we have. Okay. So one is swastasya, swastarasya. The whole of swastarutta will deal you with how to maintain a healthy image. Okay. So here the 50% of Ayurveda will lies in swastarutta. Okay, we have 2 aims, 2 visions of Ayurveda. So why Ayurveda we have to learn? What are the duties of Ayurveda doctor? So first aim is to maintain health in a healthy individual, swastasya swastarakshanam, and one more is atarasya vikara prasham. We need to cure the disease in diseased patients. Okay, so 50% of the job, 50% of Ayurveda doctor job is to maintain a health in a healthy individual. So what happens nowadays? People will come to the clinics only when they have illness. Okay, when they have a disease. That scenario has to change. We need to maintain wellness in a patient. Okay, to not to convert a patient into an illness. Wellness will maintain their health in a healthy condition. So that's why the branch Swastarutta emerged, and we need to maintain the wellness or disease-free life in a individual. That comes in wellness. Okay, so I have seen in many metro cities and in so many clinics, they have written like Ayurveda wellness clinics. Okay, so they will work only on wellnesses, not on illnesses. So actually, that is a good one. You will be without any tension and stress. You can work with the patient. Here, you don't need to cure any diseases, just to maintain healthy individual. If disease comes, you can refer to some other place. Okay, it's very clear. We need to maintain healthy individual. Here we can lead stress-free life as a doctor. When disease patient comes, if you give medicine, when disease will not cure again, you will get a restriction. Okay, they won't refer the patient to us, and overall income will reduce. But in wellness, it is not like that. So here we will going to maintain healthy individual. So and how to do wellness clinics? Okay, so how to do marketing? How we can run a wellness clinics? So based on our Rutucharya and Dinacharya protocols. Okay. So how to run a wellness clinics based on our Dinacharya and Rutucharya protocols. So Panchakara, regular Rutushodhana. Rutucharya will directly proportional to our Rutushodhanas. So regularly we can advise Rutushodhana in the individual. So in today's paper, uh, we have seen India will witness epidemic cancer within 10 to 20 years. So people will die because of cancer. Huge number of patients will die because of cancer in few years in India. It becomes a pandemic country for the world. Cancer. Still, we have not adopted uh, good diagnostic criteria. Genomic diagnosis is was not done in India. So when we check the individual, if the gene is active, the particular cancer gene is active. So that diagnosis, pre-diagnosis was not there in India, and nobody will go to that pre-diagnosis. Okay. So in developed countries like UK and USA, they have an advanced technology for diagnosis of cancer in early stages. So that is a drawback. And in India, people will come to the doctor at second stage or third stage or fourth stage. So here the preventive aspect is huge on the hands of, on the shoulders of the doctors. We need to prevent it. So prevention in the levels of many diseases, many autoimmune diseases. So many lifestyle disorders like diabetes, hypertension, hypothyroid, lifestyle disorders. PCOD is a lifestyle disorder. So even musculoskeletal disorders will also come in lifestyle disorders. Even more inquiries will be there. More patients will come to other clinics with these 4 to 5 diseases: allergy and asthma, diabetes, hypertension, hypothyroid, musculoskeletal diseases. Autoimmunity will come in later stages. First, they will try in allopathy medicines, it won't work. So they will tell you can continue the medicine for lifetime. Then they will turn up it to Ayurveda. So otherwise, so we have a huge scope in treating a lifestyle disorders. In advance, how to prevent lifestyle disorders? So then you can question yourself how to prevent whether my mother and father is having a diabetes, how to prevent me from a diabetes, how I can prevent myself from diabetes. So the only one answer in the classics what we are getting is Rutu Shodhana. Okay. So regular Rutucharya Palana and as well as Rutu Shodhana. Okay. So in a year at least you should undergo 2 to 3 Panchakarma procedures according to the Rutu. So usually in Vasanta Rutu, Kapha Prakopa will be taken place. During Kapha Prakopa we need to advise Vamana. So during Sharad Rutu, Pitta Prakopa will take place. During Sharad Rutu, we will advise Virechana and as well as Rakta Mokshana. Okay. So in the month of Varsha, there is a Vata Prakopa. So during that month, we need to advise Bast. Okay. So 6 months in a month, we need to operate wellness schemes. Only 6 months in a year. So all the procedures we have to advise. Bangalore like cities, we can elongate up to 9 months. Okay, 1 month and a half before and after 15 days extension. We can run wellness clinics up to 9 months. During illnesses, we can advise Panchakarma at any season without waiting for a season and a half. So that is the standard rule or a thumb rule in case of disease. If patient with a disease comes, you can advise Omana Vidachana, Bhaskara, or any of the treatment protocols at any season. Okay. But when you are doing it for a wellness, so you should advise according to Rutu. Otherwise, you will do Panchakarma Pachara. That will lead to some other diseases. Okay. So this is very important to run a wellness clinics. Okay. So lifestyle disorders, autoimmune disorders. Okay. So footstyle disorders. So easily we can prevent by taking proper Rutu Shodhana. It is easy and easily we can materialize it and easily we can uh, gain faith in a patient. Easily we can build money also. Very good scalability we can do. So many centers, many Ayurveda centers are running only with Abhyanga and Svedana. So people have a huge inquiry for Abhyanga and Svedana. So they will come and they will pay for Abhyanga and Svedana. Many areas in Kerala, they will do only some superficial treatments. No Antarparivarsana. If you want to stay in Kerala for 10 days, in 10 days they will do Abhyanga, Vamana, Virechana, Rakta Mokshana, Sarvangadhara, every treatment they will do within 10 days. Sadhya Vamana, Sadhya Virechana, Sarvangadhara, Udvartana. So all body including 3 days basti after that. All body purification therapies they will do in 10 days. And charges will be 1.5 lakhs for 10 days. So even abroad patients, many patients will visit India during November, December, and January for wellness clinics. Okay, so especially the beach resorts and all, they will come here and they will stay and they will take some Panchakarma treatments and they will go back. So in a state, like UK countries and neighboring countries of UK, the cold countries. So their temperature will not go more than 20 all over the year. Sunny day means it's under 24, 25 maximum temperature. So the people residing in those countries, they will visit temperate countries, temperate zones like India. So during hot season for the treatment. Even the cost of treatment in Russia per day for simple abdenga is costing about 80,000. In Switzerland and New Zealand countries, so it's also around same 12,000 to 18,000. In India, they are coming and they do treatment means it comes under 1,500 to 3,000 per session. Even for all the treatment, food, residency, everything, you can charge up to 10,000 per day. Those peoples, so foreign peoples, they will pay easily. Even it will comes with everything. Food, accommodation, medicine, treatment, everything will come under one day of one session of Abhyanga in their workplace. They will happily pay. So like that Indian turnover in wellness clinic is crossed more than 10,000 crores. 10,000 crores in a year. Especially people visit to Goa and Kerala. So they are running good. So like that we can establish our wellness clinics anywhere in the country. The good ambience and comfortable treatment we can give. So it's expensive investment. We need to invest the crores of rupees for wellness clinics. And how can we set up some wellness clinics within 5 to 10 lakhs means we can set up what Panjagama Center. We can start wellness treatments. That's easy. And easily we can scale up our consultations and scale up our income source. Okay, it's easy. What I'm telling you is an easy job. So don't worry about when after giving a treatment to psoriasis whether it will come, it will cure or not cure. Nothing to worry. So just do your job. And meanwhile, you will prevent many diseases. We are doing proper Shodhana and proper uh, Panchakarma treatment according to Rutus. So that is the need of the hour. So don't concentrate only on consultation income. Don't concentrate only on these incomes. So no need to open Panchakarma clinic. Open a clinic and refer to the patient to the Panchakarma centers. You will get your referral benefits same time. Okay, or your own Panchakarma clinic or you can refer to some other areas. The thing is, you must have a good talent to convince the patient, okay, and console the patient towards a Panchakarma therapy. And you should explain what are the benefits of Ayurveda Panchakarma. Definitely they will come to your place. Okay. So we have started cancer care clinics and we are into a cancer care group since 3 years. Total outcome, how to prevent a cancer in the potential carriers. Potential carriers are those people, those family members who have suffered with cancer. We can call them as a potential carriers. Their mother and father or their grandma maybe suffered with a cancer. So there is a chance of getting cancer in their future. In those patients, so what is the best thing we can do is proper to show them. Okay. Same thing in case of Sahaja Vyadhis, any genetical diseases. So any chromosomal anomalies, so any chromosomal diseases, the one and only the preventive method is so doing proper shoulder and following Rutucharya, following proper Dinacharya, following proper Satruta and yoga and way of natural living. So yoga and naturopathy get an appreciation from all over the world. So within 10 years, all our world doesn't need any other yoga therapist or any other yoga consultant from India. They will learn, those people come to India and they will learn everything. So it becomes famous all over the world. Before that, they used to go for a gym and other workup exercises. So now it is time to go for a yoga. Okay. Even WHO also announced World Yoga Day. Okay. So in this regard, there is a huge scope for wellness trends. So wellness, dinacharya, rutucharya, yoga, meditation, and natural way of living. All these areas has a huge scope. Along with some rasayana therapy, we can do it. So according to the Rutu Rasayana. So Aritaki is a Rasayana. So Aritaki along with some Patyas, you can advise Aritaki all over the year. Okay, Rutu Aritaki. So you can advise Aritaki all over the year. And one more counseling we have to do is, so which are the rasas we need to consume during a particular Rutu? Predominant rasas. So that's why the concept of seasonal fruits and vegetables was established everywhere. But nowadays we will get all fruits and vegetables in all seasons. We need to stick up to some fruits and vegetables every time. Same banana, same apple every day. Same beetroot, same carrot, same beans every day. With the 3 to 4 vegetables, 2 to 3 fruits, will satisfy all year. So this is not the way to live according to Ayurveda. We have to stick on to seasonal fruits and vegetables. What are the fruits and vegetables comes in a particular season? You need to go with it. Don't stick on to one type of food. Don't stick on to monotonous vegetables and monotonous fruits. So ekarasa abhyaso sarva vyadi karak. So don't stick on to only one rasa or only one type of foodstuffs. That will lead to vyadi. It is there in Agraya. Okay, so one rasa abhyasa is not good for one. Okay. The main aim of Swastarutta, the Swastarutta is to do swastasya, swastarachana. Okay. So while explaining swastasya, swastarachana, we need to maintain swasthya of ourselves also, swasthya of social and society also. Personal hygiene and as well as social hygiene. So you remember one sloka, ita itam sukam dukkam ayastashyam ita. So in the first year BMS only in first Saita also it is there. Nashtanga, where you are come across with this sloka. Ita itam sukam dukkam ayastasya ita. Sukha, dukkha, ita. Sukha and dukkha for ourselves. We will enjoy sukha and dukkha with ourselves. Ita and aita for society. This is called as personal hygiene. This is called as social hygiene. ವೈಯಕ್ತಿಕ ಸ್ವಸ್ಥರುತ್ತ, ಸಾಮಾಜಿಕ ಸ್ವಸ್ಥತೆ. The whole of swastarutta can be divided into two broad headings. One is vayaktika swastarutta and one more is samajika swastarutta. So in vayaktika swastarutta, we need to prevent our health. We need to enjoy sukha. Otherwise, we will end up in dukkha. And also at the same time, we need to live in a society ita. Okay. We don't give ahita to the society. We should be ita to the society. So that's why we have a lockdown during pandemic seasons. Okay. One disease can be spread to many. So simple example I will give you about chicken pox. In olden days, when a person in the family get a chicken pox, so that family will be isolated. Even anybody enter into the family, before entering to that, their legs should be soaked with powder water or else then water antibiotic. And whole house will be decorated with the neem, and neem paste will be applied to the chickenpox person, and even the whole family will take bath with neem water. The neem water will be boiled with the neem leaves. The whole family will take the water with the neem. So why only the neem? Neem is an antiviral. The spreading of chickenpox virus will be prevented from the family, and this is the method of isolation in older days. The same thing we have followed during pandemic season, recent pandemic, COVID-19 infection. How to prevent COVID-19? We will cover ourselves. We want we are maintaining a social distance. So like that, we have prevented COVID-19. Again, the COVID-19 taught us how to maintain a body, how to maintain social distancing and other things. So if you not follow the social distancing and all, we will spread the disease to others. So in that way, the social harmony was spoiled. We are going to spoil the social harmony by spreading the disease to others. Okay. So how to maintain a personal hygiene? How to maintain sukha in a patient? So by following dinacharya, by following Rutu Charya, by following Isha Charya, Ratri Charya is also explained in our account. By following Sadruta. Okay. So by following Trayopastamba, not Trayopastambas, Ahara, Nidra, Brahmacharya. So, Brahmacharya according to Brahmacharya according to Brahmacharya according to Brahmacharya according to Chanaka and other aspects. Brahmacharya according to Ashtanga. Okay. And by maintaining Vegadar. What should not do? Vegadar. So these are all the kriyas we need to do for maintaining the healthy individual. So first one is following Gunacharya, then following Ritucharya, following Nishacharya, doing good work and good conduct. So Sadruta, and then so following Trayapastankas, Ahara Nidra and Brahmacharya. And one should not do Vegada. Okay, this will comes in personalized. Personalized. So Sukha, how to maintain, how to live healthy by doing all these things. Okay. At the same time, so we need to take vaccinations. Turn to the modern. We need to take modern way of living. We need to go with a proper vaccination. Okay. So when come to the nutrition, ahara, we need to maintain micro and macro nutrition properly. Micro and macro. Talk to the micro vitamins and minerals which comes under micronutrition. In macro, carbohydrates, fats, and protein. We come to micronutrition by taking proper nutrition. Aha. This is according to Ayurveda Ahara. This is according to the model. Okay. So by taking proper vaccination, so that we will prevent more of viral diseases, especially. And else, by taking proper micro and macronutrients. Again, the syllabus point is vitamins, complete vitamins, hypervitaminosis, and hypo and hypervitaminosis diseases, vitamin deficiency disorders. Okay. So regular intake of vitamin, what is the quantity of vitamin should be taken regularly. So all those things will come in the syllabus of first standard. And then incubation time of common diseases. This will come in preventive and social medicine, the separate subject of our MBBS students, preventive and social medicine. The famous book for preventive and social medicine, Park and Park. Park and Park. Okay. So, incubation period of common diseases. Okay. So here you have to learn again epidemic, endemic, pandemic. Okay. And in the same line, you can go with host and all. So all those things will come in modern syllabus. First of all, it's about personal hygiene, how to maintain a personal hygiene. So again, We'll come to social hygiene. You know about Janapada Sadhyaya. Okay. So in during pandemic, everybody will open Janapada Sadhyaya at least once or twice. From the first year BMS students to almost 70 years, 80 years old Ayurveda doctor also opened once. ಯಾವುದು ಜನಪದ ಸಂಸ್ಕೃತಿಯ ಚರಕ ಸಂಘ. To know about what are the COVID rules to be followed according to Ayurveda. Okay. So here, how to maintain a social hygiene? So by maintaining a proper water system, water and water purification, and not making an air pollution, sewage management, especially night soil. Night soil means certificated material. So what are the pits type and all? So rock filler foundation and other things. Toilet varieties and toilet types. So sewage and dead body management, cremation. Industrial hazards. And how to build an house. It's also comes in social level. So in places like Bangalore, we don't have a proper space, so that we cannot build our house. That should make problem to the others. Okay. So proper measurement should be taken, and house should be built properly. For example, the whole wall, one third will be the windows. The proper ventilation should be maintained. Proper air supply should be air and sunlight will be there for the house. Like that, we need to plan. It's called according to our Ayurveda Vastu. So according to the plan, we should go. That's why BBMP will get plan approvals. Okay. So how to build a house is also comes here. Building of the area planning, the parks and other things, everything will come in. So social hygiene. Okay. So water purification definitely they will ask like rapid sand filtration, low sand filtration, like that question. So air purification and industrial hazards. What are the common pollutants in the industry? And industrial hazards, for example, they will ask about bagosis. Why the bagosis will come? Those who are working with sugarcane industry, that dust will enter into their lungs, and the outcome disease will be bagosis. So silicosis, those who are working in silicon industry, the silicon will enter inside, that will cause silicosis. Asbestosis, those who are working with asbestosis industry, they will get asbestosis. One more disease called as farmer's lung. Okay, if the farmers are exposed to more amount of pesticides and fertilizers, so that will enter inside the lungs and it will cause asthma or COPD in the farmers. It's called as farmer's lung. Okay, so like that, some industrial hazards also there, so you should go with it detail. And proper maintenance of sewage water, uh, aerobic fermentation. So aerobic method is maintaining in Bangalore and sorry, anaerobic fermentation. Here in Bangalore, we don't see open sewage things. Any road, anywhere, you can't see open sewage system. It's anaerobic fermentation, anaerobic sewage system. So it's under the north. So just to look into Chennai or some other place, it's aerobic fermentation. Everywhere some open sewages we can see in other places. But in Bangalore, it is not open. It is underground sewage system is maintained. So that we can't get a smell of this sewage. This even except Raj colors also only 30 to 40% Raj colors are open. Remaining large colors also covered with cement blocks. Okay, it's in a Bangalore method is anaerobic fermentation. Okay, it's also one of the PGD question. Aerobic fermentation or anaerobic fermentation. Okay, so this comes in social hygiene. Okay, even in one question paper, what is the length of a sand bed in rapid sand filtration? That was the question. Have you visited water filtration centers? Okay, their sand beds are made. First method is circulation or allow the water to stand for some days so that a major amount of water will be settled. Then these water will be passed through the sand beds. So the sand beds are around 1.2 meter, 1.2 meter width sand beds. Okay, so the water will be passed through the sand bed, and then they will do chlorination and other methods. Then, during sand bed filtration, major mud and other pollutant will be absorbed. So, there is a PGT question as 1.2 meter. The length of sand bed is 1.2 meter. Okay, and how many steps involved in rapid sand filtration? That was also a question. Who is the founder of Rock Filter Foundation? Good question. And soft water or hard water? Soft water and hard water. So it's also comes in swasta vrutta. Okay. So all vitamins, vitamin deficiency disorders come here. And vaccination. We should take proper vaccination to prevent the diseases. Okay. And diet. What are the diet should be maintained according to the calorie? How much calorie food is needed for normal human being? What is the amount of food for hard worker? What is the amount of food needed for sedentary lifestyle persons? So amount of calories needed for pregnant women. So these are all questions coming swasta. Okay, so ida items come to come Aistasya, ida item. So ida and aida for the society and Fuka and Dukka for ours. We'll enjoy. So swastasya swasta rakshana natarasya udara prashna. So swasta rakshana is the main aim of Ayurveda. Here we can do good things. Okay, that is a huge gift we can give unto the society. Swastasya swasta rakshana. And on our side also, we can also get very good payment. Fame just preventing or just giving a healthy society to the nation. Okay, health is most important. So nowadays, the many industries runs only for good health. Okay, so the modern industry, what they are doing is they are treating. They are treating a disease. So there is no health prevention concept in the modern. Okay. The modern doctors and allopathy doctors only their role comes when the patient comes to the clinic. Here the role of Ayurveda, the role of yoga, role of naturopathy is huge. We are the persons we can do prevention of disease in a healthy individuals. If you prevent the disease, these people become jobless. Allopathy people become jobless. Only diabetic industry in India running about 17,000 crores a year. Only the disease diabetes. I'm not telling you about hypertension. I'm not telling you about thyroid and other diseases. Only diabetes in India. The scalability of diabetes medicines in India is around 17,000 crores a year. Only one disease. 7.8% of Indians are diabetic. 13.4% of Indians are pre-diabetic. And they will convert. So in total, 20% of Indian population is diabetic. 20% is a huge amount. We have 150 crore populations means around 30 crores people are suffering with diabetes. 30 crore. Here we have a huge scope for reduction of diabetes, prevention of diabetes, reversal of diabetes. We have a huge scope, definitely. Okay, so it's only a diabetes. I'm not telling you about hypertension, cardiac disorders, or musculoskeletal. So insomnia is a big disease nowadays. It takes psychosis many times. Okay. Constipation. The only Kayam Churna tablet, how much scalability of Kayam Churna tablet, they are given advertisement in the TV. 78 crores last month. Only single tablet all over India. Kayam Churna. All over India, 78 crores in a single month. That is the scalability of single tablet. How much people are purchasing our Ayurveda drugs? You know what is the sale of Shamaprasha during COVID season? 1,500 crores Chyawanprash sold in a month during COVID. Even more than paracetamol. People purchased Chyawanprash more than paracetamol. Paracetamol purchase ಮಾಡಿದ್ದು only 650 crores. 650 crores costing about 50 paise to 1 rupee per tablet, costing about around 350 to 400 crores. Our Chyawanprash scalability is 1,500 crores. Okay, 120 CR Indians purchased at least 4 tablets each. That scalability was around 650 crores. But Ayurveda only Chyawanprash rocks, and total thing was 1,500 crores. So we can do a lot of things with wellness clinics. Only with Dinacharya, Ritucharya, proper Sadruta Palana. Okay. So Trayopastambas, Ahara, Nitra, Brahmacharya. So Ahara in total, Ahara Vidhi Visheshayatana, all these things. So how it will digest, everything. So how to take food, wholesome food, everything will come in Ahara. Okay. So in classics, Charaka, Sushruta, and Vakata, our Nidanas are based on Ahara. The whole of Ayurvedic education mainly depends on Ahara, not depends on microbial theory. So Krimi explained in only few chapters of Ayurveda. In modern, except metabolic disorders, except lifestyle disorders, everywhere Krimi will come. More importance in modern is given for Krimi, microbial diseases. In everyday day-to-day practice, so wherever you go in the clinical practice, day-to-day clinical practice, what disease they will treat? Upper respiratory infection, lower respiratory infection, gastroenteritis, finished. Only three. So cough, cold, fever, headache, or else gastroenteritis, vomiting, low motion. Yes. So if you want to practice general medicine means only these people will come. Max to max is joint pains, one painkiller per prescribed. So modern GP practice will finish within 10 drugs. One painkiller, one anti-inflammatory drug, one antacid, one 2 to 3 antibiotics. Finish. Within 10 drugs, they will finish their practice. And people will also go to the clinics with the sorts of complaints. There is a less score of exploration. In Ayurveda, we are the doctors for everything. Here I am the physician for common cold to cancer. When common cold also will treat, cancer also will treat. C to C. In Ayurveda, we will do C to C practice. Simple cold to cancer. So here I am the king for everything. ನೀವು ಯಾರಿಗೂ ರೆಫರ್ ಮಾಡೋದು ಅವಶ್ಯಕತೆ ಇಲ್ಲ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಇಲ್ಲ ಅದನ್ನ ಟ್ರೀಟ್ ಮಾಡ್ತೀನಿ ಕಾಮನ್ ಕೋಲ್ಡ್ ಎಸ್ ಐ ವಿಲ್ ಓನ್ಲಿ ಟ್ರೀಟ್ ಸೊ ಎನಿ ಡಿಸೀಸ್ ಯು ಆರ್ ದ ಕಿಂಗ್ ಹಿಯರ್ ಇನ್ modern it is not like that so even you are not authorized to practice all the drugs modern medicine again yeah there is a reference system even the MBBS plain MBBS doctor also not authorized to practice everything if some thing comes they have to refers to the particular fraternity, the particular branch experts. Okay, that comes. They used to say for a first general physician or endocrinologist. Artho, they used to refer to orthopedician. Gynecologists, they refer to gynecologist, or to dermatologist. So the system was there. Referral system was there. Urologist, okay, kidney related and nephrologist. Everywhere the referral system was developed in modern. But in Ayurveda, so there is no such proper reference system on the system still today. So we are the king for everything. We can do anything and everything in our own way. Okay. So Swasta is a good branch. You can establish
Okay. We'll go with the previous year question papers about swasta vrutta. Incubation period of chickenpox. Incubation period of chickenpox. 11 to 21 days, 3 to 7 days, 1 to 3 days, 3 to 9 days. Here highest is 11 to 21 days. Second one is 3 to 7 days. Third is 1 to 3 days. Fourth is 3 to 9 days. So highest they are given is just particular highest on 11 to 21 days. What is the incubation period of chickenpox? If you just open and see Parik, so they are given 10 to 14 days. So ನಮ್ಮಲ್ಲಿ ಇಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ 4 answers ಅಲ್ಲಿ ಕೂಡ in the all 4 answers the most nearing answer is 11 to 21 days. Okay, 11 to 21 days. Yamadamshta Kala is described by Charaka, Sharangadara, Ruddavagbata, Bhavaprakash. So where you will get the explanation of Yamadamshta Kala. Yamadamshta Kala explanation is there in Sharangadara Samhita. Okay. So what is called as Yamadamshta Kala? The last 8 days of Margashira.
Last 8 days of
How many
Kartika.
days is called as Yamadamshta Kala? 14 days or 16 days?
16 days.
14 days is Rutu Sandhi. 16 days is Yamadamshta Kala. Kartika and Margashira. So last 8 days of Kartika and first 8 days of Margashira Masa. The Rutu Sandhi between Kartika and Margashira. So that 16 days is called as Yamadamshta Kala. So this concept is explained in Sharangadara Samhita. Okay. So what it means, Yamadamshta? In the same shloka, Acharya explained, if you not maintain Agni properly during that period, during particularly during that 16 days, so that will lead to an Agni Vaigunya and that will lead to deadly diseases. So Yama will take out your prana. Because of that deadly disease, you will going to die. So that is the concept of Yamadamshta Kala explained in Sharangadara Samhita. So Acharya Sharangadara not explained about Rutu Sandhi. 14 days Rutu Sandhi like Egela. He explained only one Rutu Sandhi of this Kartika and Margashira Masa, 8 days. Okay. So 8 days of Kartika and 8 days of Margashira. If you won't maintain the Agni during the particular period, so Yama will take out Prana during that period. Which is called as slim disease. Which is called as slim disease. Slim disease. About slim disease. Option A tuberculosis, option B AIDS, option C leprosy, option D cholera. So usually in our clinical practice, if patient comes with weight loss, an adult patient or any patient, sudden weight loss, we will think about first disease is diabetes, second disease if they have cough, tuberculosis, third one we will think about cancer. So before 10 years, we will think about AIDS also. Sudden weight loss. So continuous weight loss since 3 to 4 months. Maybe immunodeficiency virus. So out of these 4 diseases, which disease is called as slim disease? Either ಇಲ್ಲಿ ನಮ್ಗೆ ಎರಡು disease ಗೊತ್ತಾಗುತ್ತೆ, ಒಂದು TB ಇನ್ನೊಂದು AIDS. So in both the cases, sudden weight loss will take place. Cholera So during cholera, weight loss will be there. During infectious period, there is a weight loss. After that, there is no weight loss. So leprosy, there is no marked weight loss in initial days. Later on, there will be weight loss. But out of these four diseases, which disease is called as slim disease? The particular name has been given. Slim disease. TB na AIDS. Okay, we'll give up the other two diseases. Cholera beda and leprosy beda. We will take out these two and we will give you
Yes.
50-50 now. TB na AIDS.
Yes, sir.
TB solution ಆಗ್ತಾರೆ AIDS solution ಆಗ್ತಾರೆ ನೇಮ್ ಗಿವನ್ ಆನ್ಲೈನರ್ಸ್
Yes, sir.
ಇದೇ ಮಾಡ್ಬಿಡಿ
Yes.
ಇದೇ ಹೇಳಿ ಆನ್ಲೈನರ್ಸ್
Yes, sir. Yes.
ಇದೇ ಹೇಳ್ತಾ ಇದ್ದೀರಾ ಇಟ್ ಈಸ್ AIDS.
Yes.
AIDS is called as slim disease. Spot the mineral which is associated with insulin synthesis. Spot the mineral which is associated with insulin synthesis. Answer na chat box ಅಲ್ಲಿ ಹಾಕಿ ಆಗಿದೆ. So those who want to answer, just write in the chat box. Spot the mineral which is associated with insulin synthesis. ಯಾವುದು? Copper, cobalt, iron, zinc. Which is the mineral present in insulin? You know about insulin. Insulin is produced from isolate of Langerhans, alpha cells of Langerhans. So all pancreas has both alpha and beta, two types of cells. Alpha cells will produce insulin, beta cells will produce glucagon. So one is catabolic hormone, one is anabolic hormone. Okay, insulin is anabolic hormone. It will increase body weight. Glucagon is catabolic hormone. It will convert fat into glucose. Insulin will convert glucose into fat, and also it will helpful in glucose transport in the body. Okay. ಯಾವ್ದಪ್ಪ? In online, Swati, Deepika, Vidya, they are telling zinc. It's 100% true. The mineral is associated with insulin synthesis is zinc. Okay. The heat output per hour during a physical exertion may go up to. Purely social and preventive medicine question. The heat output per hour during a physical exertion may go up to. During physical exertion may go up to 400 BTU, 200 BTU, 4000 BTU, 6000 BTU. ಇದು ನೀವು ಇಂಟರ್ನೆಟ್ ಅಲ್ಲಿ ಹೋಗಿ ಸರ್ಚ್ ಮಾಡಿ ಕ್ಯಾಲ್ಕುಲೇಟ್ ಮಾಡಿ ಕಂಡುಹಿಡಿಯಬೇಕು. ಈಸಿಲಿ ವಿ ಕೆನಾಟ್ ಆನ್ಸರ್. ಇನ್ ಅವರ್ ಹೌ ಮಚ್ basal metabolic rate will increases, how much heat is increases in the body. So answer is 4000 BTU. Answer is 4000 BTU. Just check in the internet about the heat calculation during exercise. Deficiency of dash vitamin results in stomatitis, keratitis, and growth retardation. Stomatitis, keratitis, and growth retardation. Deficiency of dash vitamin leads to stomatitis, keratitis, and growth retardation. Vitamin B1, vitamin B2, vitamin B7, vitamin B6. B2, riboflavin. Stomatitis, keratitis, and growth retardation because of deficiency of vitamin B2, riboflavin. A chronic Ocular stomatitis, so mouth ulcers, is because of deficiency of riboflavin, vitamin B2. Okay. Dhumapana, if let out through the nose, results in Dhumapana, if it is let out through the nose, results in one rule is there in Dhumapana. So if you take Dhumapana through the nose also, if you take Dhumapana through the mouth also, we should give it out through the mouth. So if you let it out Dhumapana through the nose, so what will be the outcome? Options: A. Pratinaha, B. Mukadosha, C. Drustivigata, D. Badirya. So what will happen? Dhumapana, if let out through nose, results in Pratinaha, Mukadosha, Drustivigata, Badirya. Answer is Drustivigata. There is a problem with eyesight. Okay. Drustivigata will take care of this. Gandusha with dash removes slimminess of mukha, relieves burning sensation, and heals ulcer quickly. Gandusha with a dash removes slimminess of mukha, snigdhatva of mukha, relieves burning sensation, and heals ulcers quickly. And heals ulcers quickly. Vrutta, Madhu, Taila, Madura Gandusha. Vrutta, Madhu, Taila, and Madura Gandusha. ಯಾವ್ದಪ್ಪ? Vrutta, Madhu, Taila, and Madura Gandusha. So Taila will not take out Taila from the mouth. Slimminess from the mouth. So first is Snigdhatva should be taken out. Is Madhu. Answer is Madhu. Next question. In Rudroga, consuming milk, curd, and jaggery. Consuming milk, curd, jaggery, ghee, and meat of animals from aquatic and marshy regions is indicated in Rudroga, consuming milk, curds, jaggery, ghee, and meat of animals from aquatic and marshy regions is indicated in option A, Vataja, option B, Pittaja, option C, Kafaja, option D, Krimija. Indicated in Vataja Rudroga. Vataja. The disease which develops from inadequate, improper, and excess use of any kind of madhya get relieved by. The disease which develops from inadequate, improper, and excessive use of any kind of madhya gets relieved by. Simple question is, Madhatya will get relieved by consuming the same Navamadhya. Option A, proper use of the same. Option B, Ashtanga Lavana. Option C, Draksha Asava. Option D, none of the above. Option A, proper use of the same. Same means Madhya. In Madhatya, Acharya advised to take Navamadhya. So in Madhatya condition, the undigested Madhya will act as a Kshara inside the body. Okay. Kshara is alkali. And the Navamadhya is act as an acid. So Navamadhya predominant of which rasa? Amla rasa. Amla is acid. So acid plus alkali will leads to base, madura. Acid and alkali meets and it will become madura rasa. So that is the equation given by Acharya Charaka in during in Madhya in and also in Madhya treatment. The undigested madhya in the body in the Raktava sources started as Akshara. If you consume Navamadhya, so that is Amla rasa predominant, then Kshara plus Amla becomes Madura. The equation is clear. Amla plus Kshara is equal to Madura. This is the equation explained by Acharya Charaka in Madhya Adhyaya. Okay, should remember. So ನೀವು ಅಲ್ಲಿ ನವಮದ್ಯ ಕೊಟ್ಟರು ಪರವಾಗಿಲ್ಲ ಅಥವಾ ಬೇರೆ ಏನಾದ್ರು ಆಮ್ಲ ಕೊಟ್ಟರು ಪರವಾಗಿಲ್ಲ, that will come to an end. Madhya will come to an end. So usually in the case of modern alcohol indigestion cases only, they will put them under vitamin injections. In some patients they will put in vitamin C also. So vitamin pyridoxine they will put. Vitamin B complex injection they will put along with IV fluid. Some patients they will keep it vitamin C injections also. Okay. In modern also they are also giving the same line of treatment. How the body mass index BMI is calculated? How BMI is calculated? How BMI is calculated? BM is equal to weight in kg and height in meter square. BM option 1. BM is equal to weight in kg and height in meter square. Option B. BM is equal to weight square comma kg square divided by height in meters. Option 3. BMI is equal to height in meter divided by weight in kg. Option 4. BM is equal to height in meter square divided by weight. What is the correct answer? Huh? Weight in kg by height in meter square. This is the correct answer. BMI can be calculated with the formula weight in kg divided by height in meter square. Which of the following vaccine is not a live attenuated vaccine? So, which among the vaccine is not a live attenuated vaccine? Which among the following vaccine is not a live attenuated vaccine? Option A, injectable polio vaccine. Option B, oral polio vaccine. Option C, measles vaccine. Option D, BCG vaccine. So, which among the following vaccine is not a live attenuated vaccine? So, what vaccine we are using today for polio, oral OPV? It's a live vaccine. Okay, so that's why after consumption of these vaccines also there is a 0.001% chance of getting polio. So that's why from 2020 WHO has mandated that we need to give IPV, IV injectable polio vaccine. IPV vaccine is a dead polio vaccine they are using in injectables. They're using dead polio virus in injectables. That's in IPVs, injectable polio vaccines. Even in PSCs also, they have made it mandate. At least one dose of IPV should be advised for kids within 6 months IPV. OPV ಕೊಡ್ತಾರೆ, so during birth or within 4 weeks of birth. But ಇವಾಗ IPV ಮ್ಯಾಂಡೇಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. So upcoming government vaccines are IPV and one more is pneumococcal pneumonia. So ಅದು ಕೂಡ ಫ್ರೀ ಅಲ್ಲಿ ಕೊಡಿ ಅಂತ ಹೇಳ್ತಾರೆ. Japanese encephalitis already they are given free. Japanese encephalitis. Answer is injectable polio vaccine is not a live attenuated vaccine. The proportion of individuals with disease in a population is called as the proportion of individuals, right? The proportions of individuals with disease in a population is called as option A, incidence, option B, prevalence, option C, risk ratio, option D, odds ratio. Option A, incidence, option B, prevalence, option C, risk ratio, option D, odds ratio, ODDS, odds ratio. The proportion of individuals with the disease in the population is called as prevalence. Haritaki should be taken with dash dravya in Sharad Ritu in order to achieve its rasayana effect. Anupana of Haritaki in Sharad Ritu. Option A, Sharkara. Option B, Guda. Option C, Madhu. Option D, Saindava. Sharad Ritu. Which dosha will get Prakopa in Sharad? Pitta. Pitta Kanapana in Role. Guda, Madhu, Saindava, Sharkara. Vatake Saindava. Madhu is for Kapha. Okay. Guda Ushna ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಗುಡ ಕೊಟ್ರೆ. So correct answer is Sharkara. ನಿಮಗೆ ಗೊತ್ತಿಲ್ಲ ಸುಮ್ಮನೆ ಗೆಸ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೂ ಕಾಮನ್ ಸೆನ್ಸ್ ಅಲ್ಲಿ ಗೆಸ್ ಮಾಡ್ಬೋದು. ಸೈಂಧವ ಲವಣ is ಅನುಪಾನ in ವರ್ಷ ಋತು. ಮಧು is ಅನುಪಾನ in ವಸಂತ ಋತು. ಓಕೆ, ಬಿಕಾಸ್ ಇಟ್ಸ್ ಕಫ ಪ್ರಕೋಪ ಕಾಲ ಅವಾಗ. ಇದು ಸೈಂಧವ ಲವಣ ವರ್ಷದಲ್ಲಿ ವಾತ ಪ್ರಕೋಪ ಕಾಲ. If you give a Guda will aggravate Pitta again. So the best answer is Sharkara. Out of Sharkara and Guda, the common answer is Sharkara. Which guna brings ahladana in the body? Ahladana in the body. Which guna brings ahladana in the body? Shita guna, Drava guna, Snigdha guna, Mrudu guna. Ahladatva in the body. Shita. ರಷ್ಯಾದಲ್ಲಿ ಯಾವುದೋ ಪ್ಲೇಸ್ ಅಲ್ಲಿ ಟೆಂಪರೇಚರ್ -64. -64. ಬೆಂಗಳೂರು ಟೆಂಪರೇಚರ್ ಇವಾಗ 10, 11, 12 ತನಕ ಹೋಗ್ತಾ ಇದೆ. ಅರ್ಲಿ ನ ಮಾರ್ನಿಂಗ್ 10, 11, 10 to 13. Shita. Madhodakam is an example of Madodakam is an example of. It's not Vastrutta, it is Sanskrita, Sandhi. I tell you, Sandhi made it. Dirga Sandhi, Goda Sandhi, Yana Sandhi, Ayadi Sandhi. Dirga. Madodakam is an example of Dirga Sandhi. But last 2 years, Sanskrit ಕೊಡ್ತಾ ಇಲ್ಲ ಕ್ವಶನ್ಸ್. ಈ ವರ್ಷನೂ ಇಲ್ಲ, ಹಿಂದಿನ ವರ್ಷನೂ ಇಲ್ಲ ಸಂಸ್ಕೃತ ಕ್ವಶನ್ಸ್. ಅದು 3 ವರ್ಷ ಹಿಂದೆ ಬಂದಿತ್ತು. ಲಾಸ್ಟ್ ಇಯರ್ಸ್ ಇಂದ ಕೊಡ್ತಾ ಇಲ್ಲ. ಗುಡ್ ಲಕ್. ನೋಡೋಣ. As per Acharya Charaka, following are included under Bala Ruddhikara Bhavas. As per Acharya Charaka, following are included under Bala Ruddhikara Bhavas. Bala Ruddhikara Bhavas. Adana Kala, Abhigata, Ati Vyayama. According to Acharya Charaka, following are included under Bala Ruddhikara Bhavas. Bala Ruddhikara Bhavas. Ali ಯಾವ್ದು ಅಂತ. Option A, Adana Kala, Abhigata, Ativyaya. Adana Kala will not going to increase Bala. Visarga Kala will going to increase Bala. So that this option can be deleted. Second option, Ahara Sampat, Sharira Sampat, Swabhava Siddhi. Yes. Ahara Sampat, Sharira Sampat and Swabhava Siddhi. So consider ಮಾಡ್ಬೋದು. ಯಾವುದಕ್ಕೆ? ಬಲ ವೃದ್ಧಿಕರ ಭಾವಾಸ ಅಂತ. ಆಪ್ಷನ್ ಸಿ ನೋಡೋಣ. ಆಪ್ಷನ್ ಸಿ ನಲ್ಲಿ ಆಹಾರ ಸಂಪತ್, ಶರೀರ ಸಂಪತ್, ಆದಾನ ಕಾಲ. ಅಗೇನ್ ಆದಾನ ಕಾಲ ವೋಟ್ ಇನ್ಕ್ರೀಸ್ ಬಲ. ಸೊ ಅದು ಆಪ್ಷನ್ ಅಲ್ಲ. ಫೋರ್ತ್ ಆಪ್ಷನ್, ವಿಸರ್ಗ ಕಾಲ, ಆಹಾರ ಸಂಪತ್, ಅಭಿಘಾತ. ವಿಸರ್ಗ ಕಾಲ ಅಕ್ಸೆಪ್ಟ್ ಮಾಡ್ಬೋದು, ದೆನ್ ಆಹಾರ ಸಂಪತ್ ಅಕ್ಸೆಪ್ಟ್ ಮಾಡ್ಬೋದು, ಬಟ್ ಅಭಿಘಾತ ಕ್ಯಾನ್ ಬಿ ಅಕ್ಸೆಪ್ಟೆಡ್. ಸೊ ದ ಆನ್ಸರ್ ಈಸ್ ಆಹಾರ ಸಂಪತ್, ಶರೀರ ಸಂಪತ್ ಅಂಡ್ ಸ್ವಭಾವ ಸಿದ್ಧಿ. ಆಹಾರ ಸಂಪತ್, ಶರೀರ ಸಂಪತ್ ಅಂಡ್ ಸ್ವಭಾವ ಸಿದ್ಧಿ. ಯೋಗಾದ್ಮೇಲೆ ಕೂಡ ಡೀಪ್ ಕ್ವಶನ್ ಕೇಳಿದ್ರು ಡ್ಯೂರಿಂಗ್ ದಟ್ ಪೀರಿಯಡ್, 17-18 ಕ್ವಶನ್ ಪೇಪರ್ಸ್ ಅಲ್ಲಿ. ಸೊ ವಿಚ್ ಸ್ಟೇಟ್ಮೆಂಟ್ ರಿಗಾರ್ಡಿಂಗ್ Paschimottanasana is correct? Which statement regarding Paschimottanasana is correct? Beneficial in low back ache, beneficial to reduce fat around belly, beneficial in third trimester of pregnancy, beneficial after abdominal surgery. Paschimottanasana. For belly fat reduction. Paschimottanasana. Asana advised during obese patients. Asana is advised for obese patients, central obesity. As per Atta Yoga Pradipika, the Shat Karma should be done in case of. As per Atta Yoga Pradipika, the Shat Karma should be done in case of Dosha Samata, Medo Shleshma Ruddhi, Vata Ruddhi, Dhatuksha. As per Atta Yoga Pradipika, the Shat Karma should be done in case of. Shat Karmas are mainly done in case of Dosha Samatva, Medo Shleshma Ruddhi, Vata Ruddhi, Dhatukshaya. All karmas are advised, Shat karmas are advised to reduce Shleshma and Medas. Shleshma and Medas. No, Hatha Yoga Pradipika is not an Ayurveda Grantha. So it is a Yoga Grantha. And also a referring book for Yoga Shastra. If Yoga certification, you have to go with Hatha Yoga Pradipika in detail. Okay. So, Meda Shleshma Ruddhi, in this condition, we can advise Shat karmas. As per Geranda Samhita, which of the following season is best suitable to start yoga practice? According to Geranda Samhita, which season is the best to start yoga practice? Shishira, Vasanta, Grishma, Varsha. ಸುಮ್ಮನೆ ಗೆಸ್ ಮಾಡಿದ್ರು ವಸಂತ. ಗ್ರೀಷ್ಮದಲ್ಲಿ ತುಂಬಾ ಹಾಟ್ ಕ್ಲೈಮೇಟ್ ಇರುತ್ತೆ, ಸೊ ಬೇಡ. ವರ್ಷದಲ್ಲಿ ಸಿಕ್ಕಾಪಟ್ಟೆ ಮಳೆ ಇರುತ್ತೆ, ಬೇಡ. ಶಿಶಿರದಲ್ಲಿ ತುಂಬಾ ಕೋಲ್ಡ್ ಇರುತ್ತೆ, ಬೇಡ. ಸೊ ದ ಮೋಸ್ಟ್ ಕಂಫರ್ಟಬಲ್ ಸೀಸನ್ ಟು ಸ್ಟಾರ್ಟ್ yoga is ವಸಂತ. ಸೊ ನೋಡಿ, ನ್ಯೂ ಇಯರ್ ರೆಸಲ್ಯೂಷನ್ಸ್ ಎವ್ರಿವೇರ್. ಸೊ ದೇ ಆರ್ ಕನ್ಸಿಡರಿಂಗ್ ನ್ಯೂ ಇಯರ್ ಆಸ್ ಎ ಜನವರಿ. ಸೊ ಫಾರ್ ಹಿಂದೂಸ್ ನ್ಯೂ ಇಯರ್ ಇಸ್ ವಸಂತ. ಸೊ ನಮ್ಗೆ ನ್ಯೂ ಇಯರ್ ರೆಸಲ್ಯೂಷನ್ ವಿ ಶುಡ್ ಸ್ಟಾರ್ಟ್ ಯೋಗ ವಿತ್ ಫ್ರಮ್ ವಸಂತ ಋತು. ಆಫ್ಟರ್ ಯುಗಾದಿ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಯೋಗ. ಓಕೆ, ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ. The Dhumapana commonly indicated for healthy individual is type of Dhumapana commonly indicated in healthy individual is Prayogika, Snehika, Virechanika, Kasagna. Prayogika, Snehika, Virechanika, Kasagna. The Dhumapana indicated for healthy individual. Prayogika, Snehika, Virechanika, Kasagna. Prayogika, healthy individual. Yamaha meaning the principle which are required to control some activity behavior according to Patanjali is of dash types. Yama meaning the principles are required to control some activity. The behavior according to the Patanjali is Yama Niyama. You know about it. So Yama means some conducts should be maintained before achieving, before going for asanas. Yama, Niyama, Asana, Pranayama, Pratyahara, Dhyana, Dharana, Samadhi, Ashtanga Yogas. So first is Yamas. So Yamas and Niyamas, how many types? 5. 5 Yamas and 5 Niyamas. Under Trivida Lakshana of Pranayama, Madhyama Pranayama is associated with. Under Trivida Lakshana of Pranayama, Madhyama Pranayama is associated with. Madhyama Pranayama is associated with perspiration, kampa, breathe will be steady or motionless, none of the above. Under Trivida Lakshanas of Pranayama, Madhyama Pranayama is associated with perspiration, kampa, breathe will be steady or motionless, none of the above. Breath will be steady or motionless. Kumbhaka. During yoga abhyasa kala, dash forms aitahara. Which among the following is an aitahara using yoga abhyasa kala? During yoga abhyasa kala, which is becomes aita ahara. Option A snigdha, option B harita shaka, option C ekakala bhojana, option D tilataila. ಆ ವರ್ಷ ಆನ್ಸರ್ ಕಾಂಟ್ರವರ್ಸಿ ಆಯ್ತು ಇದು ಕ್ವಶನ್. ನೋ ಅಥೆಂಟಿಕ್ ರೆಫರೆನ್ಸ್. ಸೊ ಕೆಲವೊಂದ್ ಕಡೆ ಅವ್ರ ಆನ್ಸರ್ ಕೊಟ್ಟಿದ್ದು ಏಕಕಾಲ ಭೋಜನ ಅಂತ. ಒಂದೇ ಟೈಮ್ ಊಟ ಮಾಡಿ ಯೋಗ ಮಾಡಬಾರ್ದು ಅಂತ ಒಂದ್ಸಲ ಕೊಟ್ರು, ಇನ್ನೊಂದ್ಸಲ ತಿನ್ನೋದೆಲ್ಲ ಅಂತ ಕೊಟ್ರು. ಸೊ ದ ಆನ್ಸರ್ ಬಿಕಮ್ಸ್ ಕಾಂಟ್ರವರ್ಸಿ ಅಂಡ್ ಕ್ವಶನ್ ವಾಸ್ ಕ್ಯಾನ್ಸಲ್ಡ್. Under national immunization schedule for infants of 10 weeks, dash is indicated. Among national immunization schedule for infants at 10 weeks, dash is indicated. BCG if not given at birth, DPT first dose and OPV first dose, DPT second dose and OPV second dose, DPT third dose and OPV third dose, measles vaccine. So just think about 10 weeks. So at the birth, we will give you BCG and OPV. So then again 4th week, so BCG, OPV and DPT first dose at 4th week. sorry, 6th week, 1.5 month. Again in 10th week, in a 4 weeks of gap, again DPT second dose, OPV second dose. Again in 14th week, DPT third dose, OPV third dose. Usually you know it 1.5 month, 2.5 month, 3.5 months. 6 weeks is 1.5 months, 10 weeks is 2.5 months, 14 weeks is 3.5 months. DPT and OPV, continuous doses. First dose will be at 1.5 months, 6 weeks. Second dose will be at 10th week, 2.5 months. Third dose will be at 14th week, 3.5 months. Here, the second dose of DPT and OPV should be administered at 10th week. Answer is second dose of DPT and OPV. WHO has established international network of laboratories for monitoring and study of air pollution. The center in India is at. WHO has established so many laboratories to control air pollution, controlling and monitoring of air pollution. The headquarters in India is Lucknow, Hyderabad, Nagpur, Pune. Sorry, Lucknow. Air pollution controller. WHO Constitution came into force on WHO Constitution came into force on 5th April 1948, 7th April 1948, 7th April 1946, 7th April 1949. So every year we will celebrate World Health Day on 7th of April, the remembrance of establishment of WHO, World Health Organization. Okay, so WHO came into force from 1948, 7th April. The acceptable range of pH of drinking water is in between. The acceptable range of pH of drinking water is in between 6.5 to 8.5, 6 to 7, 7.5 to 8.5, D none. Acceptable range of pH of drinking water in between 6.5 to 8.5, 6 to 7, 7.5 to 8.5, none. Acceptable range of pH of drinking water is in between 6.5 to 8.5. Acceptable range of drinking water pH is 6.5 to 8.5. So you may see advertisements about alkaline water. Acid water is not good for health. We need to keep our blood with an alkalinity, so that will prevent a lot of diseases. It will act as a scavenger. So scavenging effect, when it will take out some antioxidants from the blood, some toxins from the blood. So this alkaline water will act as a detoxifier in the body. So even in a cancer patients, they are advising alkaline water. The acceptable pH is more than 7, 7.5 to 8.5, the acceptable pH of alkaline water in the body. According to Bhava Prakasha, Sarva Rogaha Haritaki refers to Vijaya, Amaya, Amruta, none. Sarva Rogaha Haritaki is Vijaya. Number of yamas, repeated question. Number of yamas. Ahimsa, Satya, Asteya, Brahmacharya, and Aparigraha. Ahimsa, Satya, Asteya, Brahmacharya, and Aparigraha. Yavudu? Yamas. Niyamas. Shaucha, Santosha, Tapa, Swadhyaya, and Ishvara, Pranidhana. Shaucha, Santosha, Tapa, Swadhyaya, and Ishvara, Pranidhana. Niyamas. 5 yamas and 5 niyamas. The National Program for Control of Blindness was launched in the year 1976, 1968, 1978. 1976. Blindness Control Program launched in the year. National Program for Blindness Control launched in the year 1976. Most frequent complications of measles. Most frequent complication of measles. Bronchitis, otitis media, encephalitis, pneumonia. So most frequent complication of measles, bronchitis, otitis media, encephalitis, pneumonia. Most frequent complication of measles, bronchitis, otitis media, encephalitis, pneumonia. Encephalitis. Raw beef tongue is due to the deficiency of riboflavin, niacin, thiamine, none. Raw beef tongue is due to the deficiency of riboflavin, niacin, thiamine, none. Answer is niacin. Raw beef tongue, write down niacin. Mental phenomena is present in. Sorry. Vitamin C is called as. Vitamin C is called as niacin, ascorbic acid, thiamine, cyanocobalamin. Ascorbic acid. Which of the following group is termed as three stone of the body? Three stone of the body. Which of the following group is called as three stone of the body? Etulinga Aushadha, Aharanindra Brahmacharya, Sharirindra Yamana, Vata Pitta Kapha. Three stone is called as Vata Pitta Kapha are called as three stones of the body. According to Charaka, which one is Patya Dravya among the following? According to Charaka, which one is Patya Dravya among the following? Option A Kshira, option B Takra, option C Haritaki, option D Shunti. Patya. Haritaki Patya na. Al ಮೇಲೆ ಅಕಾರ್ಡಿಂಗ್ ಚರಕ ಅಂತ ಕೇಳಿದ್ದಾರೆ ಅಗ್ರಯ. Everybody must memorize agreyas without fail. All 153 agreyas of charaka should be memorized without fail. We can expect 1 to 2 questions from agreyas. 1.5 page ಅಲ್ಲಿ 1 marks ಬಂದೇ ಬರುತ್ತೆ. According to charaka, which kshira is hayitam among all kshiras? Which kshira is hayita among all the kshiras? Mahisha kshira, ajakshira, avikshira, ustakshira. ಅಜಕ್ಷೀರ is ಶ್ರೇಷ್ಠ. ಮಹಿಷಕ್ಷೀರ ಕೂಡ ಸ್ವಪ್ನಜನಾನ, ನಿದ್ರ. ಔಷ್ಟ್ರಕ್ಷೀರ ಉದರದಲ್ಲಿ ಹೇಳಿದ್ದಾರೆ. ಔಷ್ಟ್ರಕ್ಷೀರ is explained in ಉದರ. So then ಐತಕ್ಷೀರ is ಅವಿಕ್ಷೀರ. ಅವಿಕ್ಷೀರ. Defective dark adaptation is early clinical feature of. Defective dark adaptation is the early clinical feature of vitamin A deficiency, thiamine deficiency, niacin deficiency, folic acid deficiency. A. So, defective dark adaptation is the early feature of vitamin A deficiency. Which among the following is a daily regimen is good for healthy eyes? Healthy eyes. Which among the following daily regimen is good for healthy eyes? Pratimarshanaस्य, ಪಾದಾಭ್ಯಂಗ, ಶೀತಜಲ ಶರೀರ ಸ್ನಾನ. Correct alla? All three are good for health. Padabhyanga is also good for healthy eyes. Shita is good for eyes, and Pratimarshana is also good for eyes. ಅದೇ ಆನ್ಸರ್. ಬೇರೆ ಬೇರೆ ಆನ್ಸರ್ ಏನ್ ಕೊಟ್ಟಿದ್ದಾರೆ ನೋಡೋಣ. ಅಂಜನ, ಪಾದತ್ರ ಧಾರಣ, ಉಷ್ಣ ಜಲಪಾನ, ಶೀರ್ಷಾಸನ. ಉಷ್ಣ ಜಲಪಾನ ಅಲ್ಲ. ಅಂಜನ, ಪ್ರತಿಮಾರ್ಶನಸ್ಯ, ಆಚಮನ. ಪ್ರತಿಮಾರ್ಶನಸ್ಯದಲ್ಲಿ ಕಣ್ಣಿಗೆ ಒಳ್ಳೆದಂತೆ ಹೇಳಲಿಲ್ಲ. ಶ್ರೋತಾಂಜನ, ಸೌವಿರಂಜನ, ಉಷಿರಂಜನ, ಶೀರ್ಷಾಸನ. ಸೊ ಕರೆಕ್ಟ್ ಆನ್ಸರ್ ಇಸ್ ಪ್ರತಿಮಾರ್ಶನಸ್ಯ, ಪಾದಾಭ್ಯಂಗ, ಶೀತಜಲ, ಶಿರಸ್ನಾನ. Which of the following symptoms are produced due to the suppression of urge of defecation? Which of the following symptoms are produced due to suppression of urge of defecation? Purisha Vega Dharanajanya Lakshanas. Answer: headache, colic pain, pain in cough muscles. Headache, colic pain, and pain in cough muscles. Pain in cough muscles are the Pindikadveshtagal. Is the common feature with Purisha Vega Nigra. This is the answer. Headache, colic pain, and pain in cough muscles. Option B, itching, urticaria, rhinorrhea. Option C, stiffness, neck stiffness, aruchi. Option D, Ika, Shwasa, Shirashwala. Ivyavadu alla. Answer A is correct. Pindikadveshtagal. Coplic spots are seen in mumps, measles, rubella, vitamin A deficiency. Coplic spots are seen in measles. Kriya Yoga includes the following practices as per Patanjali Yoga Sutra. Kriya Yoga includes the following practices as per Patanjali Yoga Sutra. Tapas Svadhyaya Ishvara Pranidhana. Kriya Yoga includes dash according to Patanjali Yoga Sutra. So Dharana, Dhyana, Samadhi, Tapas Svadhyaya, Shaucha, Ahimsa, Satya, Asteya. Kriya Yoga means Tapas Svadhyaya and Ishvara Pranidhana according to Patanjali Yoga Sutra. Ahara Parinamakara Bhavas are dashing number. Ahara Parinamakara Bhavas are dashing number. 6. Pravrut Rutu is between Grishma and Varsha, between Varsha and Sharat, between Varsha and Grishma, between Shashira and Vasanta. Pravrut Rutu is between Grishma and Varsha, between Varsha and Sharat, between Vasanta and Grishma, between Shashira and Vasanta. Pravrut is in between Grishma and Varsha. So South Ali Pravrut Baralla, North Ali Pravrut Barate. Acharya Sushruta has divided South Rutus versus North Rutus. Okay, so Illi, so Pravrut means in between Grishma and Varsha. Brahmi Muhurta means 45 minutes before sunrise, 45 minutes after sunrise, 45 minutes before sunset, 45 minutes after sunset. According to these options, 45 minutes before sunrise. Now, last yama of the night is called as Brahmi Muhurta. It means to say that last 3 hours of the night is called as Brahmi Muhurta. Yavadamshta Kala is Sandhi Kala between question Kartika and Margashta. Ghee and honey is an example of equal quantity of ghee and honey is an example of Matra Virudha. Among the following, which is the best variety of soil? Among the following, which is the best variety of soil? Made soil, alluvial soil, chalky soil, gravy soil. Alluvial soil is the best variety of soil. Alluvial soil. The vector of filarial fever is. The vector of filarial fever is. The vector of filarial fever is. Culex mosquito, Anopheles mosquito, Aedes mosquito, none. Culex mosquito. Anopheles mosquito, female Anopheles mosquito is a vector in malaria. Aedes aegypti mosquito, dengue. So answer is for filariasis, Culex mosquito. Classical types of pranayama are. Classical types of pranayama are 8 at the answer 8. Okay, done. So till now we have completed maximum question papers of previous year. Here, total conclusion from the question papers is most of the questions are pertaining to dinacharya, rutucharya, ahara, vyayama, vaccination, vitamins, and as well as yoga. Okay, so then most important FAQ in Swastarutta is dinacharya, rutucharya, ahara, nidra, brahmacharya. All these three Trivapast numbers. Vegadharana also we got a questions. Okay, and then yoga. So maximum questions also came from yoga, yoga types, yoga asanas, importance of yoga asanas, and all these things. So we should concentrate on these important FAQs in future classes. So today I will stop class here. So next class I will continue with the actual syllabus of Swastarutta. This is about introduction to Swastarutta and important questions asked in previous years. Okay. There are doubts with you, onliners?